Hello, how are you guys? It's Friday, and as usual, you know that on Fridays we have the weekly five. This is it. My name is Waleshege Monyeri, and I'm the Daktari. Let's start. So, the scope for this week is easy. We shall do the back, the pectoral region, the axilla, and the brachial plexus. As you know by now, 5 questions, each has 3 parts. Let's start. On to the first question. Now, the first question is testing your knowledge of the back. Okay. And the first question asks us to identify, or rather, asks what is the collective name given to the following structures, structure A, B, and C. You can see those are three muscles which are found on either side of the spine and they erect the spine. So the collective name of that muscle is the erector spinae muscle. So the erector spinae muscle has 3 parts. A, which is the most lateral part, originates from the iliac crest and is attached to the ribs. So for that reason, it is known as iliocostalis. B, on the other hand, is said to be it's a long muscle. Okay, it's a long muscle, so it was named as longissimus. And C just lies next to the spine, so it's named as spinalis. So those are the three muscle components of the erector spinae muscle. So erector spinae is a collective term for these three. Now, the erector spinae belongs to what is known as the intrinsic muscles of the back. Okay, the intrinsic muscles of the back are different from the extrinsic muscles of the back. Let me give you an example. The muscle latissimus dorsi is found in the back, but it inserts into the humerus. So it's not an intrinsic muscle of the back, okay? So when you do embryology, you'd be told that muscles of the limb muscles originate from what is known as the hypomere, okay? The hypomere. So you initially usually have a myotome. The myotome will divide into two, an epimere and a hypomere. The hypomere are the ones which now go to form the musculature of the limbs. But some of these muscles migrate, such as latissimus dorsi, it migrates to the back. But you have the intrinsic muscles of the back originate from the epimere. And an example is the not latissimus dorsi, rather, it's the rectus spinae group. So we've been asked with an example, which muscle group would you expect to find deep? So what muscle group do you expect to find deep to the erector spinae? And the answer there is what is known as the transversal spinalis group of muscles. And an example of the transversal spinale group of muscle include multifidus, semispinalis, and what are known as the rotatores. So let me just give you a small recap of the muscles of the back, or rather the intrinsic muscles of the back, or the deep muscles of the back. They are usually organized into 4 layers: a superficial one, an intermediate one, a deep, and a deepest. The superficial one, we have what is known as the splenius group of muscles, and these include the splenius capitis and the splenius cervicis. So the intermediate layer is composed of the erector spinae group, and these include the iliocostalis, longissimus, and spinalis. The deep layer now, which is now deep to the intermediate layer, is the transversal spinalis group of muscles, and this is the semispinalis, the multifidus, and the rotatores. And then deep to that, you have the segmental muscles, which include the levatores costarum, the interspinalis, and the intertransversari muscles. Great. So those are the deep muscles of the back, and all of them are innervated by the posterior rami or spinal nerves. So they are epimeric in origin. Okay, they originate from the epimere. Okay, that is it for the back. Now let's go to the second question. The second question here is testing your knowledge of the pectoral region muscles, the muscles of the pectoral region. You've been asked to identify A, D, and E. So A there is that bone which you can feel on yourself, and that's the clavicle. B, on the other hand, or rather D, is this muscle which forms the anterior part of your shoulder. That's the anterior fibers of deltoid. And E is this vein. You can see it's that vein running on this groove between deltoid and this is deltoid, and this is pec major, pectoralis major muscle. So what is that groove is the deltopectoral groove. So that vein running there, that's the cephalic vein, the cephalic vein. So we've been asked to state the action of B and C. So you need to understand that pectoralis major has two muscle fibers or two sets of fibers. Those fibers which originate from the clavicle, identified as P, those are the clavicular fibers. Those which originate from the sternum and the ribs are the sternocostal fibers, which are identified as C. So each has different actions, okay? But both of them, we need to understand that both of them are adductors, okay? Both are adductors, but in addition to being an adductor, B also, the clavicular fibers assist in flexion, flexion at the shoulder joint. And as we have said, C is majorly an adductor, okay? An adductor, not ab, rather adductor, okay? It's an adductor. Then you've been asked to state the insertion of B. So where is pectoralis major muscle inserted? So you need to understand that it is inserted into the lateral lip of the intertubercular sulcus. And let me show you that because that is very important. So on this is the humerus. You can see we have a groove here. Sorry for that. Sorry for that. So you can see we have this groove over there. That groove, within that groove, that is where you find the tendon of the long head of biceps brachii, and that's what is known as the bicipital groove. And the bicipital groove, the bicipital groove has two lips, a lateral lip and a medial lip. Now, inserted into the lateral lip is pectoralis major. Inserted into the medial lip is teres major. Now, latissimus dorsi is usually inserted into the floor of the bicipital groove. Okay, so you need to remember that arrangement. On the lateral lip, pectoralis major. On the floor of the bicipital groove itself, it's latissimus dorsi. And on the medial lip is teres major. You need to remember that arrangement. It's very important. Now, onto the third question, still testing your knowledge of the back, but now this time we are discussing the extrinsic muscles of the back. Now, you've been asked to identify the structures ribs C, E, and F. Okay, so I'm sure by now you can tell that this here is the medial boundary of the scapula. You can see the scapular spine over there. So C, you can see it's attached. Can see C is attached there, okay, at the what is known as the superior angle of the scapula, and that muscle over there is the levator scapulae muscle, okay. Then E is this muscle attached on this fossa beneath the scapular spine, okay, so that is known as because it is below, it's below the spine, so it's the infraspinatus muscle. And F over here, this muscle here is the teres major muscle, okay. Now I've been asked to state the innervation of the structure about D. Now D, if you knew E is the infraspinatus, D automatically becomes supraspinatus. And by now you know that supraspinatus is innervated by the suprascapular nerve, which originates from the upper trunk of the brachial plexus. So the root value is C5 and C6. Been asked to state the proximal attachment of C. So C, as we stated, is the levator scapulae muscle, and it is attached onto the transverse processes of atlas, axis, C3, and C4. Okay. So the transverse processes of atlas, axis, the third and the fourth cervical vertebrae. Okay. Maybe to educate you that A is a rhomboid major, A is the rhomboid major, and B is the rhomboid minor. These muscles help with scapular retraction, okay? The retraction of the scapula. Now on to the fourth question, which is testing your knowledge of the axilla and maybe the branches of the brachial plexus. You've been asked to identify A, C, and D. So over there, C over there, and D over there. So maybe to start off with the easier one is C. C over there is the brachial artery, but before it became brachial artery, at this point where I'm pointing, at that point it is the axillary artery. Okay, the axillary artery. And if you can remember, the chords of the brachial plexus, the brachial plexus are named according to their relationship with the second part of the axillary artery. So you can see A is one of the chord of the brachial plexus, and you can see it's lateral to it. So A is the lateral chord. You can see A is the lateral chord, and from A you get B. Okay, so maybe you can have an idea what B is. Okay, so A is the lateral chord of the brachial plexus, and D, you can see it's one of the branch, but this branch is coming from the posterior chord. So it's the largest branch of the posterior chord of the brachial plexus, and that is the radial nerve, So we've been asked to name B and state any two muscles that are supplied by it. So B is that branch, the terminal branch of the lateral cord of the brachial plexus, and you can see it is piercing this muscle, and this muscle, which I'll name as K, that muscle is the coracobrachialis muscle, and that muscle is pierced by none other than the musculocutaneous nerve, and the musculocutaneous nerve supplies that muscle, so coracobrachialis, the biceps brachii, and brachialis. So the reason it is known as musculocutaneous is because once it supplies those three muscles, it continues as the lateral antebrachial cutaneous nerve, supplying the lateral aspect of the forearm. We've been asked to name F and state one entrapment point in the hand. So the way I identify these nerves, I use the M. I know you are wondering what the M is. Let me show you the M. So this is the M. You like this one. This one I know you like this one. So here is the M. Start there, the musculocutaneous, then there, and finally there. It's an M. It's somehow the outline of the alphabet M. So B, as you may know, is musculocutaneous. Now, E, on the other hand, this one, this part here, I'm sure you can see that part there, that's the lateral root, the lateral root. And this part here, that one there, which I'm trying to highlight, that's the medial root. Now, E becomes the medial nerve. E is the medial nerve. Now, this here is part of the medial cord. Whatever I'm now trying to highlight, that's the medial cord of the brachial plexus. You can see it's medial to the axillary artery. And you can see this terminal branch named F that one, named F, that one, of the medial cord. That's the ulnar nerve. That's the ulnar nerve. G there, which lies medial to the ulnar nerve, that's the medial antebrachial cutaneous nerve, or the medial cutaneous nerve of the forearm. Okay, so F is the ulnar nerve, and we've been asked to identify the entrapment point in the hand. Okay, in the hand. So in the hand, there is an important anatomical fibro-osseous canal known as the Guyon's canal, and that's one of the entrapment points of the ulnar nerve within the hand. I'll ask you, please go find out entrapment points of the following nerves: musculocutaneous nerve, median nerve, ulnar nerve, and also the radial nerve. Very, very much important. Very, very much important. So I've just told you one entrapment point of ulnar nerve in the hand. So as an assignment, please, for each of those nerves, such as say median nerve, go and look some entrapment points within the arm, within the forearm, and also within the hand. So if you can do that for all the nerves, you'll be safe. You'll have studied anatomy as you should. Okay. On to the final question. Okay, this was brief. We've been asked to identify the structures labeled A, B, and C. Okay, A, B, and C. So A is the muscle pectoralis major. It has been deflected. And B, you can see B is piercing structure E. By now, you know that pectoralis minor lies deep to pectoralis major. So E is pectoralis minor. And the structure piercing pectoralis minor is the medial pectoral nerve. So the medial pectoral nerve supplies pectoralis minor and then pierces it and proceeds to supply pectoralis major. Okay, then C, you can see it's on the lateral part. It does not pierce pectoralis minor. So that's the lateral pectoral nerve. Lateral pectoral nerve. Been asked to state the insertion of E. So pectoralis minor muscle inserts into the coracoid process of the scapula. I'll ask you once again, and I'll show you this. Please know all the muscular attachments of the scapula. That's a high-yield sport marathon question. We've been asked to identify or name the branches of D. Okay, so D over here, you can see it's a vessel. Okay, so it's coming from the second part of the axillary artery. Okay, so it's one of the two branches of the second part of the axillary artery. Remember, the two branches of the second part include the thoracoacromial trunk, which you are looking at, which usually skirt the upper border of pectoralis minor, and the other one is the lateral thoracic artery, which usually skirt the lower border of the pectoralis minor muscle. Okay, so this one is at the upper border of pectoralis minor, and that's the thoracoacromial trunk, and it gives off four branches. The way I remember them, I just say cadavers are dead people. So C is the clavicular branch, A is the acromial branch, D is the deltoid branch, and P is the pectoral branch. Okay, yeah, there it is. And we are done. Just before we are done, this is just an image. You can pause here. Please check on these muscular attachments of the various muscles on the scapula. I will emphasize this because this is a high yield area. It's tested a lot of times. You need to understand the various muscular attachments. Yep, and we are done for this week's weekly 5. Stay tuned for next week's weekly 5, but before that, please check out the upper limb playlist. I have a very good video on the brachial plexus. Please check it out. It will be very much helpful. And with that, I am done. See you next week. Bye.